Imagine a world where different community service providers, health workers, educators, social workers can seamlessly work together, using an integrated platform to understand the needs of the people they serve. That's the power of an effective digital community system, or DCS. At the heart of a DCS is a focus on person-centered care, which means the system isn't just gathering data or passively supporting service delivery, it is designed with specific individual needs in mind. Meanwhile, DCS embraces a multi-sectoral approach. It connects sectors like education, housing, and social services, ensuring that the client's needs in all areas are addressed. DCS not only boosts efficiency, it delivers high-quality care that is constantly improving. By gathering real-time data, community service providers across sectors can respond quickly to the client's needs, ensuring that every decision is based on up-to-date insights and is matched with coordinated support. This system is equitable because it gives everyone, regardless of their background, access to the same high-quality services. Whether you're from an urban or rural area, the system makes sure you're not left behind due to socioeconomic factors. To illustrate all this, let's take a look at a persona use case. Meet Stella, a 13-year-old girl who's recently dropped out of school. During a routine checkup, her community health worker, Zuri, notices that Stella is struggling, so she quickly reaches out to Tendai, a social worker. Tendai visits Stella's home and talks with her and her family. Together, they come up with a plan to help Stella go back to school, with support like education subsidies. But during a follow-up visit, Tendai learns that Stella has some important health concerns. So Tendai talks to Stella about safe sex, HIV, and family planning, and helps her get the care she needs. Stella then visits the health center where she gets tested for HIV and receives the family planning method that works best for her. But here's the catch. The system that helped Zuri and Tendai is not always as connected as it should be. Service providers often struggle with digital tools that don't fit their workflows, forcing them to spend extra time on data entry. This means they can't always get the right information when they need it or offer the best support in the moment. For Stella, this fragmented system could lead to missing important pieces of her story. She might have to repeat her information at each visit or face delays in getting the care she needs. That is why we need a digital system that connects the dots, offering seamless, person-centered care. Community health workers like Zuri often face challenges with disconnected systems, fragmented tools that slow down care and create barriers for both providers and clients. But with digital community systems, things change. During a routine visit, Zuri learns important information about Stella and quickly records it in the DCS. Instead of navigating separate systems, Zuri refers Stella to Tendai, the social worker, with just a few taps. Instantly, Tendai receives the referral, and Zuri is notified of any updates on Stella's progress, ensuring continuous and connected care. Later, Zuri notices a health need and sends a digital referral to the health clinic. The nurse is immediately alerted, and Zuri gets a reminder about Stella's upcoming appointment, keeping the process smooth and efficient. In doing so, she shifts from just providing care to becoming a health navigator, ensuring better outcomes for Stella and the entire community. The efficacy of DCS is often impaired by a lack of coordination among sectors supporting community services, coupled with weak governance structures. Collectively, this contributes to a siloed approach in both community services and the implementation of digital tools. Effective governance is crucial to address and prevent silos and fragmentation in multi-sectoral community services. One way to help mitigate these challenges is to convene key stakeholders in a collaborative workshop setting. To help foster this collaboration and strengthen DCS in low to middle income countries, USAID and the Data for Implementation project co-authored the Digital Community Systems Toolkit, resources for developing person-centered digital tools to support delivery of integrated community services. This document is a resource that guides community service stakeholders through the process of designing and adopting person-centered and integrated digital community systems. The DCS Toolkit provides guidance for diverse stakeholders involved in leading the digital transformation of community services. It emphasizes the importance of a structured approach to ensure that DCS are centered around the individual and the community. The toolkit serves as a practical guide for policymakers, implementers, and stakeholders involved in digital health, focusing on person-centered and integrated digital ecosystems. By promoting partnerships and collaboration among key stakeholders, we can enhance service delivery, system maturity, and stakeholder collaboration, strengthening community health services both nationally and regionally, and contributing to a more equitable and sustainable digital transformation. Thank you for your time and attention. You can access the DCS Toolkit through the link on your screen, where you will also find additional resources related to DCS implementation and collaboration. Interested in learning more about the toolkit or building DCS in your community? Feel free to connect with the Data.FI project through our LinkedIn, and we can put you in touch with one of our technical experts.